If you are looking for what causes lower back pain, you're in the right place. I'm going to share with you 5 things that could contribute to lower back pain, and then stick around to the end because I'm going to share what that all means. If you haven't already, please like and subscribe this video and subscribe to this channel so you can see much more content that I put out. If you're new to this channel, I am Dr. Nate and I'm a physical therapist, and I created this channel to help people overcome pain, learn and understand about it, live well, and just get strong. Learn to get strong, because I love getting strong, you love getting strong, we all love getting strong. So let's jump right in. So number 1, I don't like this term that much, pinched nerve. And the reason I don't like it is because people envision it as this nerve is getting like super pinched down by the bones, and that you have to somehow take the pressure off of that. We don't necessarily actually have any evidence that happens. There are definitely some cases that there is a narrowing of the space between the vertebrae that do cause some compression, but that doesn't always cause pain. So what I like to share with people is that it's likely more of an irritation of the nerve. If you have pain that goes down the back of the leg, down the front of the leg, down the middle or inside of the leg, that's likely due to some sort of irritation of the nerve. Could it be that it's being pressed upon by the bones? Absolutely, could happen. This also happens with number 2, which this pinched nerve sensation or impingement, which again, I don't like that term, can be contributed to by a herniated disc, where the disc material, the disc is basically this gelatinous shock absorbing structure in between each of your vertebrae. So here's your vertebrae, and then your disc is in the middle of that. And sometimes it can bulge out or herniate and put some more pressure on some of those nerve roots. Again, this sometimes happens, doesn't always lead to pain and disability, but it can sometimes do that. So that can further irritate a nerve that's close to the spine, and then cause the symptoms that go down the back of the legs. Number 3 is stenosis, and stenosis is more common in people over the age of 60 and onwards, and that's just a narrowing of it can be a narrowing in various spots. So it can be a narrowing of the middle or central canal of the spinal cord, or it can be a narrowing of the foramen or the foramina, these little exits where the nerve roots exit from the spinal cord. So those are different contributors to some of this impingement or sciatic type nerve symptoms. Oftentimes stenosis will cause symptoms on both sides, so on the left and the right side, versus where like a traditional radiculopathy or impingement or sciatica will travel down one side. So that's one way to differentiate that. And typically people who develop, like I said before, typically people who develop some sort of stenosis, it's when they're getting older, so 60 and older. Number 4, back spasms, so muscle guarding. A lot of people experience these horrible back spasms. It's like a 10 out of 10 pain. Happens when people have been in car accidents, when people lift something up that they weren't used to lifting up. Maybe they lifted something heavy. It could have even been like a sock. They just bent over and picked up the sock, and like now they have this tremendous back pain. But the thing to know about these back spasms and muscle spasms is sometimes they just happen randomly, and it's not something that is necessarily dangerous, although it hurts like heck. It really does, and it does not feel good. So these muscle spasms, they are more mysterious, as they just kind of come on randomly. I will share in future videos of I'm going to make one specific video about back spasms and how I experienced that when I was deadlifting. So be on the lookout, subscribe when that video comes out. Those are really like the 4 things that I see most often. One thing that I do want to touch on, and this is number 5, is red flags. So a red flag being something that is dangerous, that does require immediate surgical or medical intervention. So for example, if you have an infection, you are going to need to get on medication, right? So sometimes back pain can be caused by different types of infections, right? So it's very rare, and all of these things I'm going to share of red flags are very rare, like less than a couple percent, like 2 or 3%. So don't worry too much about that. It's just you need to know that it is a possibility. And then there's cancer. So definitely, like, cancer can be a contributor to lower back pain, but again, super, super rare. Number 3 is like a fracture. So if you are osteoporotic, then you have a higher chance of having a fracture, or if you were in some sort of like traumatic event where you fell off something of a pretty high height, or you hit your back really hard, or some other type of traumatic event, then it's possible there is a fracture in the back too. So we don't want to discount that all back pain is not dangerous. But again, like, usually it will have some sort of mechanism, or usually you'll know, like, this just doesn't feel right. So it could be a fracture if you had like a traumatic event, or you're osteoporotic and you were doing something heavy, or just something you weren't used to doing. Next thing, Cauda Equina syndrome. And that is a compression towards the end of the spinal cord. And what happens with this is people tend to lose bowel and bladder function. They tend to get worsening numbness and tingling in the feet. It's getting worse. They tend to lose reflexes, like the knee jerk reflex. So, you know, when you hit the knee and the leg kicks out, so they lose that. And then also weakness. So like, you can't lift your foot up anymore. Like, that's a problem, and you need to go talk to your doctor like immediately, and potentially even go to the emergency room. So those are some red flags that you need to be aware of. Again, they are super, super rare. And if you're on this video, probably like 98 or 99% of you don't have that going on. But if you do have those symptoms and you are concerned about that, please contact your nearest medical professional, and they can advise you. And yeah, I'll put my contact information down too, so you can shoot me a message, and I'll give you some guidance of who you can go see. And this is the thing that I really wanted you to stick around for. So this is number 6, is kind of the bonus. For all types of back pain, first we want to rule out red flags, like we had talked about. So rule out all those really scary, insidious things that we don't wish upon anybody. And then the second thing is that ultimately, like, what causes back pain, while it's good it's kind of helpful to know, what's more important is what symptoms do you have, and can we modify it? So what I mean by modify symptoms is, can we make it better with different types of exercises? If somebody comes into me and we work together for 10 minutes and I have them do a couple exercises and they already feel better, that is a good sign, because if you can do that and we can modify symptoms, it doesn't matter if it's a herniated disc or spinal stenosis or some sort of impingement type deal, it really, or a muscle spasm, it doesn't matter as long as we can modify symptoms. So that's the main thing. Those are the main takeaways. So I hope that this was helpful. I hope that you have a better understanding of what some of these things are. Make sure to check out my other videos on back pain. I'm making a ton of them. I think I have over